Hi, welcome back to the next episode of the Keto Naturopath on YouTube. I'm Dr. Carl Goldkamp, and today we're going to talk about 5 nearly generic obstacles that everybody experiences about weight loss. This will take the monkey off your back, I'm sure. At least it will mine, because it is something that is rather secret. So I call it 5 metabolic secrets. So let's just get into it. All right, so the first one is what I call fatal lifestyle discoveries. Doesn't that sound dramatic? Processed food hijacks your brain, gets you addicted, and keeps you from burning fat. It's really. And this is from The Guardian back in 2017. Processed foods are full of highly engineered additives. Food companies are, in essence, putting drugs on our foods. The correct name for this is food additive addiction, or refined food addiction. Isn't that amazing? That came from The Guardian. How appropriate that is. Here's a picture of a PET scan. So a PET scan is the uptake of glucose in your brain. And this compares a normal person to a cocaine addict to an obese person. And this shows the addictive qualities to not so much that an obese person would have, but it's really relative to refined foods and carbohydrates. For comparison, this image shows PET scans of all those. And notice that normal brain has a lot more red stuff. That's the dopamine produced in part of the brain that's associated with reward system. I'm thinking you probably know that. When some people experience a reward, say while eating a really good meal, their dopamine level spikes. So while doing that activity, the dopamine level spikes. For addicts in general, regardless of what the substance is that they're addicted to, that spike from dopamine only comes in anticipation of the reward, as opposed to the actual reward itself. Later, once the reward is gotten, the food is eaten, the drug is taken, etc., the effects are blunted because the brain has already been flooded with dopamine as it thought about the eating or the taking of it. Pretty interesting, huh? Okay, so all this changed primarily in the 80s relative to refined food, processed food addiction. So you can go way back and say, well, processed food started back in the 1700s when brown rice became just white rice. We're not going back that far. We're going back where there's chemical additives that have totally changed and purposely been put into the food, not as preservatives, but as addictive substances, so you will come back to eat that. A great example is Doritos, but we'll get into that in a second. Okay, so it all changed in the 80s. You can see that the obesity started to spike, and there was an inflection pretty much in the mid-70s, late 70s. So what happened? Before that, we ate food, sort of, and after that, we ate processed foods pretty much around the clock. And it was a big deal. It was convenient. Remember, I would go home and you'd have TV dinners. It started there, and then on and on and on, until you couldn't put down the bag of potato chips, right? Here's an example. High phosphate in processed foods, sodas, frozen foods, packaged meats, breads, bakery items. They block the ability to burn fat. They increase blood pressure. They reduce motivation to exercise. Fast food shrinks your brain and leads to insulin resistance and neurodegeneration. Big claims. Let's get behind that. So in essence, eating processed foods with all those additives and chemicals that has been structurally engineered so it responds this way, is like a greyhound chasing a fake rabbit around the track. I don't know if you know that, but they are trained by a rag. And this rag is on a mechanical gizmo, we'll say, but it's soaked in chemicals. And so these dogs are chasing it, completely driven by an addiction to the chemicals in the rag that they're chasing to stimulate an all-out craving in the dogs. That's exactly how processed foods affects us. So processed foods affects us. Some people don't want to think of it in that terms, but it's very much that terms. Time to get off that track completely, don't you think? And relax. Okay, fatal lifestyle discovery number 2. Medications that manage lifestyle diseases stop you from burning fat, no matter how much you exercise. Stop you from burning fat, no matter how much you exercise. Medications are like pesticides. Initially beneficial, we'll put that in quotes, that they kill the thing that you're after, right? Initially beneficial, but lose effectiveness over time. Your body adapts to it. You have receptor recycling and so on and so forth. Other pests adapt to it, requiring additional pesticides. That's how you end up getting 4 or 5 pesticides have to be for getting rid of mosquitoes or cockroaches or whatever the thing is. It's not just one anymore. Medications become less effective too, requiring more than one. All of those have side effects as well that will require yet more medication. So it goes on and on. So certainly they try to change the medication, but it tends to get to a number of medications over time. Medications create nutrient deficiencies, cause weight gain, and increase the likelihood of diabetes. In the US, the average men in their 50s take 4 to 5 medications daily. That's the average. Specific example, these medications cause cardiovascular drugs and the nutrients, the deficiencies. So cardiovascular drugs and antihypertensive, they, especially statins as well, they deplete CoQ10, B6, zinc, B1, etc., etc., ACE inhibitors, beta blockers, which all lead to these particular conditions. In other words, those nutrient deficiencies lead to these particular conditions. Various cardiovascular problems, weak immune systems, low energy, depression, sleep disturbance, increased cardiovascular disease risk, weak immunity, wound healing, sense of smell, taste, sexual dysfunction, depression, irritability, memory loss, muscle weakness, and edema, weak immunity, etc., etc., etc. That will require further medications and so on and so forth. Now, this is an example from an actual client patient came in and how we measure some of their nutrient deficiencies. This is intracellular, it was within the white blood cell. Should you want to know, it's SpectraCell. And do we think one test is the definitive answer for everything? No, but it's a context. It helps us get a clue. So in this case, these were the things, this person was on 4 or 5 medications. These were the deficiencies. Can I point on a per medication basis? I'd have to go research, and there are, by the way, books called Drug-Induced Nutrient Deficiencies. Go look it up. They're probably still on Amazon. And so you find these things that this person is deficient in. Oleic acid is pretty interesting. Oleic acid comes from a lot of different things. It's olive oil, it's even in dairy, but it's really not about that. What it is, it's about processed foods. If they had whole foods, a whole food source diet, they would have plenty of oleic acid. So as you get to very processed foods, that you deprive yourself of oleic acid, and that affects other fats like your omega-3s, of course. Serine, vitamin E, and borderline it was biotin, carnitine, choline, glutamine, glutathione, manganese, B1, and B3. Here's what it looks like for this particular person. The red dots are the deficiencies. The yellow ones are the borderline deficiencies. And you can see we're in the mitochondria. This is how they make their energy. Fats, carbohydrates, proteins. So without being a specialist here, you can say, if this was a sprinkler system in your backyard or your field or your farm, and you had a few problems at these designated areas, how well do you think that sprinkler system would work? Just look at it that way. And so you go, well, we'd have some problems. Couldn't burn fats very well. Can't burn proteins. There goes the gluconeogenesis, perhaps. Carbs seem to be okay, but they got the problem down here in the Krebs cycle or the citric acid cycle. Same thing. And therefore, they'd be compromised in how they could produce energy, and they would be tired. And guess what? They'd be taking another medication to make them not so tired. And this is about how it affects their neurotransmitter productions. You saw the PET scans. So now this is another way of looking at that. These are the deficiencies, and look at that. What we have is tryptophan, which goes to serotonin, tyrosine goes to dopamine, and so on and so forth. They're compromised. All of these will then compromise one's ability to make those neurotransmitters. So you had the processed foods, then you had the medications. What could possibly be next? There's another road to consider, one that leads to better health, don't you think? Okay, fatal lifestyle discovery number 3. Carbohydrate toxicity. It's a real thing. Stops your metabolism from burning fat. Oh, really? All right, what does that mean? Carbotoxicity. Noxious effects of carbohydrates. Definition of noxious, physically harmful or destructive to living beings. From one of the top scientific journals, Journal of Cell, reporting that the old way of thinking about carbohydrates is dangerous. And here's the reference to that, 2018, October 18, not that long ago, barely 3 years ago. Some of you, I hope, are thinking along these lines. All calories are not equal. It's the choices, not the portions. There's your protein, there's your fats, and there's your carbohydrates. Think of it as pretty easy to get analogies here. 2 different cars. One's all gas, the other's all electric. Which one are you going to run on? There's plenty of books out there now that the lie has been exposed and it's time to make a change about the carbohydrates. Hopefully this isn't too controversial for you. These are just some of the books that are out there. Big Fat Surprise by Nina Teicholz, excellent. But there's more on this, and it's getting to be an old drum, same drum beat, but read these books, these are excellent. Okay, on to the next. Fatal lifestyle discovery number 4. Low muscle mass severely limits your ability to burn fat. Simple truth. If you don't have the muscle, you can't burn the fat. Muscle mass is like a fire pit. Is it a candle or is it a whole fire pit? Size matters. It determines how much fuel you can burn, even when you're not exercising. Obese people with low muscle mass have 35% higher levels of insulin resistance, which means they have a greater difficulty of burning fat than people who have higher muscle mass. And that was 2014. Journal of American Geriatric Society. Low muscle mass, aka sarcopenia, and you heard me talk about that, skinny fat, is the highest risk of all-cause mortality for obese men, also for obese women. And this came in 2017. Low muscle mass is a cause of low testosterone. Low testosterone is a cause of low obesity. We're going to explore that a little bit. Effective weight loss on testosterone, merely the fact of dropping weight, however you get there, we haven't talked about the how, you can choose that. The effective weight loss on testosterone levels shows that it goes up. The more weight you lose, the greater weight loss, the greater testosterone increases for men and or women. Building muscle, it's the effort you exert, not how long or how often you work out. It's the effort you exert. When I say effort, I don't mean a 5-pound or a 10-pound. I mean, did you push hard? Was it hard for you? For some people, it could be a pound. For other people, it could be 500 pounds. Obviously, that would be a pretty strong person. So you can't compare in terms of poundage. It's the intensity of the effort. Got 30 minutes twice a week? Twice a week, high intensity training. That's all I'm going to say about that. Fatal lifestyle discovery number 5. Low testosterone will limit your ability to burn fat. Low testosterone will limit your ability to burn fat. Now I want to make a little bit of an exception here, or to explain a slightly larger context. When men and women, obviously both have testosterone, both have estrogen. The number of receptors and where those receptors are drives that difference. But for women, especially in a condition called PCOS, polycystic ovarian syndrome, we go, well, you have elevated testosterone. They do and they don't. They do because you can test in a hormone panel, you can see elevated testosterone. Well, that's the answer, isn't it? It is and it isn't. The isn't part is they have less of the binding globulin. So when testosterone rides around your body after it's made, it's not all active. Most of it's bound to a thing called sex hormone binding globulin. It makes it inactive. It's like a little bus, right? So it takes your testosterone to your little finger, but it's inactive while it gets there. And then it jumps off, so to say. Well, what happens with elevated glucose, elevated insulin, obesity in general, is that sex hormone binding globulin decreases. It therefore makes the percentage of active hormone testosterone larger. So that's the slight difference if you're interested. Obesity and low testosterone, obese men are more likely to have low testosterone, but exercise, losing weight, decreasing your carbs will increase one's testosterone level. It goes for women as well. Why testosterone is important. Low testosterone causes increase in body fat, makes losing weight very difficult, is associated with increased rates of depression, increased inflammation, joint pain, dementia, weaker bones, and poor libido. High insulin leads to low testosterone. Carb toxicity. Too many carbs for you to handle. creates a high insulin load, right? So high glucose to high insulin, then in turn decreases testosterone, and I'm going to show you that. It's a bit blinding, but I'll get to the gist of it here. This is from a portion of a hormone panel, and what's really interesting in terms of how nature works is that testosterone and estrogen are very nearly identical, but yet they're very different. We'll go into their difference later, but what happens when one has high insulin levels? The high insulin levels basically stops this particular enzyme, actually accelerates this particular enzyme from converting testosterone to estrogen. So for men in this case, all their testosterone that they produce quickly goes to estrogen. So they have, I won't call it estrogen dominance, they have a lot more estrogen than testosterone. And so what happens? They start developing female sex characteristics. They start to develop breast, which is called gynecomastia. They start developing other things as well. And so it's not about the hormone per se, it's about the carbohydrates that affected the individual in terms of glucose, the glucose to the insulin. The insulin drove the testosterone almost immediately into estrogen. So the estrogen there, you can see this person has elevated estrogen. There's 3 different types of estrogen. We're not going to get into that. I'm just saying that it gets changed to estrogen very quickly. And so now the body has to detoxify the estrogen. And that's a whole nother thing to talk about. So they're low on androgens. So testosterone is an androgen, of course, but there's other androgens as well. So basically the choice is yours, is what I'm saying. You could lose weight, exercise, lower your carbs. That's a real thing, by the way. Get off unnecessary medications, whether you're a man or woman. That's Ernestine Shepard at 85. I think she figured it out. So what side are you on? Decreasing testosterone or increasing testosterone? Age, insulin, obesity, low muscle mass, elevated blood sugar, side effects of medication? Or increase your testosterone by losing weight, resistant training. Think of sarcopenia. Decrease carb toxicity, remove the need for medications. Short and sweet. These are the discoveries that I mentioned. Processed food hijacks your brain, gets you addicted. We saw that. It makes you fat. I could have gone, there's a whole story behind that, which is really interesting. Medications create nutrient deficiencies to keep you from burning fat. Carbohydrate toxicity blocks your metabolism from burning fat. Low muscle mass severely limits your ability to burn fat. And low testosterone severely limits your ability to burn fat. So you pretty much have it stacked against you. But these are all things that you can address. So the ball's in your court. We'll talk more next time. Bye-bye.